Good afternoon, Mr. Chairman and members. I would like to begin by accepting the amendments and thank the chairman and the committee for working with me to make this bill a much better bill before us today. Thank you for allowing me to present Assembly Bill 2179, which seeks to give local government greater flexibility and reduce costs related to training of non-medical personnel to administer the rapid testing for hepatitis C in community settings. Early detection of hepatitis C virus reduce the likelihood of disease spread, reducing the cost of treatment, and prevent new infections from spreading throughout the community. Testing is a critical part of identifying and eliminating the hepatitis C virus and the need to be targeting to high-risk groups in the community. Current training is centralized at the state level and requires a non-medical personnel who wants to offer hepatitis C testing to those individuals around HIV and AIDS. Community-based organizations that are willing to provide hepatitis C often experience challenges in training their staff because of the long wait time received by trainings, which sometimes takes up between 6 to 18 months. In addition to the challenges caused by the long wait time, the HIV training is unnecessary for hepatitis C testing counselors working with organizations that do not provide HIV testing. This bill would decentralize trainings for hepatitis C counselors by allowing county public health departments to certify training standards for rapid testing counselors and streamline the testing process. With a cure of hepatitis C now a reality, there are more resources going towards testing and more people are being trained and certified. Expanding access to clarifications for hepatitis C testings will improve awareness of hepatitis C status and reduce regional and income disparities. Here to provide supporting testimony is Emily from Project Info, who will answer any questions and provide some technical responses to any questions the committee may have.
Please go ahead. Thank you.
Good afternoon, Chair and Committee. Thank you for hearing from us. My name is Emily Hirio, and I'm from Project Inform. We're the sponsor of AB 2179. We interviewed a number of community programs that want to or do provide hepatitis C testing, and they identified significant barriers to screening at-risk populations for hepatitis C. One barrier that was identified was that even when programs have funding to purchase hepatitis C test kits and to pay staff to do testing, they have a very difficult time accessing hepatitis C specific training in their jurisdiction, or they cannot afford to send staff to a 4.5 or 5 day HIV hepatitis C training that's usually held in the Bay Area or in Los Angeles. There's 4 to 5 times more hepatitis C than HIV in California, but current law ties the test counselor training for hepatitis C to the HIV test counselor training. Hepatitis C is more geographically dispersed than HIV, more often found in rural and suburban areas, as well as in urban communities. AB 2179 would trust local health officers and local health departments to certify a training for the Hep C rapid test, a test that's been judged by the federal government to be easy to use and very low risk. And I'm happy to answer any questions you may have. Thank you.
Glenn Backus for Drug Policy Alliance in support.
Thank you. Others in support?
Jerry Jeffrey, representing the California Chronic Care Coalition, in support.
Thank you.
Jasmine Gordon on behalf of the California Black Health Network in support.
Thank you.
Kathy Mossberg, San Francisco AIDS Foundation, in support.
Thank you very much. Anyone in opposition? See no one. I'll wait for a second here in case I'm too quick on the draw. Okay. I'll bring it back to the committee for questions or comments. Comments or questions from the committee? Okay, seeing none, we'll let you close, Mr. Gibson.
Thank you very much, Mr. Chair and Committee. I believe this is a great bill, and certainly this will certainly help my community, the South Los Angeles area, Watts area, and surrounding areas of the County of Los Angeles. Again, want to underscore The wait time between 6 to 18 months is totally unacceptable. And certainly by working with the committee as well as the committee chair, this bill before us is a good, sensible bill, and I certainly encourage an aye vote on Assembly Bill 2179. Thank you very much for your time.
Thank you very much for bringing this forward. Certainly, in the training challenges for any sort of healthcare providers is huge in all areas of the state. So, especially in some of the rural areas. So, I appreciate what you're doing here, and thank you for bringing this forward. We'll ask the secretary to call the roll. The motion. Do we have a motion? I'm sorry. We have a motion from Mr. Ridley Thomas. Second from Mr. Mainsheim. The motion is do pass as amended to appropriations. Thank you for accepting the amendments, and we'll call the roll.
Wood?
Aye.
Wood, aye. Mainshine? Aye. Mainshine, aye. Bonilla? Burke? Campos? Chu? Dababne? Gomez? Hernandez? Lackey? Nazarian? Aye. Nazarian, aye. Olson? Patterson? Ridley Thomas? Aye. Ridley Thomas, aye. Rodriguez? Santiago? Steinnorth? Thurmond? Waldron? Waldron, aye.
Your vote is 5-0. We need 5 more. We need more members, so we'll leave the roll open for you. And thank you very much. I'm going to open the roll also. I'll open the roll on a couple of bills that we've heard already.
Thank you very much, Mr. Chair.
Thank you, Mr. Gibson. Appreciate that. First one would be Bonta, AB 1644. It's not been moved, so. Second. So we have a motion, Mr. Ridley Thomas, second from Mr. Nazarian. The motion is do pass as amended to appropriations. Madam Secretary.
Wood?
Aye.
Wood, aye. Mainshine? Aye. Mainshine, aye. Bonilla? Burke? Campos? Chu? Dababne? Gomez? Hernandez? Lackey? Nazarian? Yes. Nazarian, aye. Olson? Patterson? Ridley Thomas? Aye. Ridley Thomas, aye. Rodriguez? Santiago? Steinnorth? Thurmond? Waldron? Waldron, aye.
That is also 5-0. We'll leave the roll open. And the other bill that we have heard but not voted on yet is AB 2345, so we need a motion for that. So moved by Mr. Ridley Thomas, the author. You can move that. We'll let you do that, sir. And then seconded by Mr. Nazarian. So we'll take a vote.
Wood?
Aye.
Wood, aye. Mainshine? Mainshine, aye. Bonilla? Burke? Campos? Chu? Dababne? Gomez? Hernandez? Lackey? Nazarian? Aye. Nazarian, aye. Olson? Patterson? Ridley Thomas? Aye. Ridley Thomas, aye. Rodriguez? Santiago? Steinnorth? Thurmond? Waldron? Waldron, aye.
That was also 5-0. We need 5 more votes there. We'll go ahead and call up our next author, who is Mr. Eduardo Garcia. Item number 15, AB 2394. Mr. Garcia.
Mr. Chairman and members, thank you for the opportunity. Thank you for moving the bill first and second. Just very quickly, this bill is critical for low-income beneficiaries who may not have access to a reliable source of transportation to be able to get to their needed services. It specifically clarifies the non-medical transportation that is a Medi-Cal benefit and includes round-trip transportation for members to obtain covered Medi-Cal services. I respectfully ask for your aye vote.
Thank you. Witnesses?
Good afternoon, Chair, members. Linda Way with Western Center on Law and Poverty, proud sponsors of this important measure. Many rural consumers report difficulty accessing medical care due to lack of adequate transportation. This bill would provide these beneficiaries with the needed clarity. Specifically, this bill would clarify that non-medical transportation is a covered Medi-Cal benefit to and from covered Medi-Cal services. I'm here to answer any technical questions, but with me is Liza Vantranon with Legal Services of Northern California to highlight the importance of this bill to rural consumers.
Thank you.
Good afternoon. Mr. Chair and members, my name is Liza Thanchanon. I'm the managing attorney of the Health Rights Unit at Legal Services of Northern California. We provide direct legal assistance to health consumers in 32 Northern California counties, many of which are very rural. It's not surprising that access to specialty care can be really difficult in rural areas. There are simply fewer providers. But since the expansion of Medi-Cal managed care in the California's rural counties, we've seen a persistent problem with people being able to access care because they're simply being sent to specialists who are farther away. For low-income Medi-Cal beneficiaries, getting to a specialist who is far away is often very challenging because public transportation is not available. They don't own a car and/or they just can't afford the trip. I frequently see clients miss appointments and or forego care altogether because they just could not find a way to get there, or they go without other necessities instead. I had one client who lived in El Dorado County and urgently needed to see a urologist for multiple visits. Her Medi-Cal plan sent her to a specialist that was 166 miles away round trip. She was lucky in that she had a car and she could drive herself, but she had to stop paying her utility bills in order to afford the gas money to get to those appointments, and ultimately she had her electricity shut off. We had another client from Mendocino County with a neurodegenerative condition which causes widespread nerve damage in his body, including in his skin. He was referred to a dermatologist in San Francisco, which is 240 miles round trip from his home. Because of the medications he's on, he cannot safely operate a vehicle on his own, and the only public transportation option from San Francisco to San Francisco would take 3 buses, 6 hours one way, and require at least one night overnight stay. His only realistic option is to pay out of pocket for a driver to take him, which is a significant financial burden, is not always feasible. So these cases are not anomalies, but they're pretty illustrative of the cases we've been seeing with people having access or difficulty accessing necessary medical care. Clarifying that non-medical transportation is a Medi-Cal benefit would give rural residents a meaningful access to specialty care. Thank you.
Thank you very much. Others in support?
Kimberly Chen with the California Pan-Ethnic Health Network in strong support.
Thank you.
Tam Ma with Health Access California in strong support.
Thank you.
Christina Romero with Planned Parenthood Affiliates in strong support.
Thank you.
Eduardo Martinez with the California Medical Association in support.
Thank you.
Betsy Armstrong on behalf of the County Health Executives in support.
Thanks.
Michelle Cabrera with SEIU California in support.
Thank you.
Would be the in-between section. Kathy Mossberg with the Local Health Plans of California. We have a supportive amended position. We look forward to working with the author's office. We certainly understand the importance of this service and wish to provide it to our clients, but we do want to talk about how we would make sure that the reimbursement is adequately dealt with as we move forward. Thank you.
Thank you.
Good afternoon, Mr. Chair and members. Bill Barnaby on behalf of the California Medical Transportation Association. We're kind of in that in-between also. I've been working in this area for over 30 years, and medical transportation has become less and less available over time to Medi-Cal recipients. And now you have these transportation brokers. The situation is even worse. There's no oversight by DHCS of the transportation brokers. They do what they want. DHCS won't even make available their subcontracts with the health plans. So until somebody takes a close examination of what's going on in the medical transportation industry totally, this is just, it's a nice step forward, but nothing much is going to happen until you get a handle on these transportation brokers. Thank you very much.
Thank you. So we've had people in support, some tweeners. Anybody in opposition? Okay, seeing no one. Questions or comments from the committee?
Mr. Garcia, would you consider dealing with the transportation brokers if you determine that to be an issue, or did you already know about that?
That came up today, and we'll be happy to work with all of the stakeholders, and so the answer is yes.
Excellent. Thank you, Mr. Chairman.
Okay, and first of all, and then so anyone else? I'm sorry. Okay, seeing no one else, I want to thank you for bringing the bill forward. I know this bill pretty well.
Thank you. Thank you for your leadership on this.
Happy to be and proud to be a co-author with you on this. We represent opposite corners of the state with the same exact problem. This is an issue. The bill was vetoed last year. My hope is that with the passage of the MCO tax and a stable source of funding for Medi-Cal, we'll be able to move forward on this bill, which is critically important to people, especially those in the rural areas. So I thank you for bringing it forward. We have a motion and a second. The motion is due pass to appropriations, and we'll call the roll.
Wood?
Aye.
Wood, aye. Mainshine? Mainshine, aye. Bonilla? Burke? Campos? Chu? DeBobne? Gomez? Hernandez? Lackey? Nazarian. Nazarian, I. Olson. Patterson. Ridley Thomas. Ridley Thomas, I. Rodriguez. Santiago. Steinorth. Thurmond. Waldron. Waldron, I.
So we have five votes. It's 5-0. We need some more members, and so we'll leave the roll open for you. Thank you very much. We're going to move. Seeing no other authors, we do. Oh, I'm sorry, Ms. Brown. My apologies. I'm sorry. You snuck in on me. Ms. Brown, please come forward. And Ms. Brown, you have item number 16, AB 2425.
Ms. Brown, you may proceed. We have a motion. Do we have a second? We just have a motion right now. A second.
Thank you, Mr. Chair and members. AB 2425 will require the California Department of Health to work collaboratively with health and safety experts to develop statewide uniform site reporting requirements for unintentional injury incidents. Before this time, we have not had a procedure for data collection. This helps us with that collection. With me today are two of our sponsors, and they will self-introduce.
Witnesses in support, you have two witnesses up to 3 minutes each.
My name is Steve Barrow, and I'm with the Advocates for Health and Economic Development. I'm one of the co-chairs statewide of the California Unintentional Injury Strategic Plan for children 0 to 19. This is one of the top 10 issues identified by over 70 stakeholders that help do that strategic plan for the state. And it's awfully critical that we have this. As the Assembly member stated, we don't have a uniform way of collecting just basic information, prevention information. We have enough injury data. When we hit the hospital, the ER, we know what kind of injuries we're getting, but we don't know a lot about the scene, the setting where these injuries are taking place. And to do better prevention, we need this plan in place, the types of forms that need to be filled out by the different entities at the local level so that we can have the information to do a better job. Unintentional injury is the #1 cause of death and hospitalization in California for our 0 to 19-year-old kids. We lose the equivalent of 3 elementary schools full of children killed every year. That's 375 average-size elementary schools, 3 of them every year by preventable causes. And the only way we're going to get at the bottom of this and stop this from being the leading cause of death and hospitalization is to have better information and data.
Mr. Chairman, members, Kathy Barankin. I'm Executive Director of the California Coalition for Children's Safety and Health, and I would just support what Mr. Barrow stated. This is a real critical issue for us in terms of finding ways to prevent unintentional injury among children. So we strongly support the bill.
Thank you. Further witnesses in support, name and organization and position only, please.
Dr. Amy Moulin from the California chapter of the American College of Emergency Physicians. We're in support of this bill and think it's an important initiative to prevent injury and illness. Thank you.
Thank you. Any further witnesses in support? Seeing none. Witnesses in opposition? 2 witnesses up to 3 minutes each.
Good afternoon, Mr. Chair and members. Betsy Armstrong with the County Health Executives Association, but today testifying on behalf of the Emergency Medical Services Administrators. While MSAC is certainly supportive of the value and use of injury prevention data collection, their concern lies with the expectation that first responders would be compelled to complete an incident site report when their focus should always be on patient care and transport. While the bill is currently drafted, tasks the California Department of Public Health with bringing together stakeholders to develop standards and protocols for establishing this uniform site incident report, it would still require someone or some entity at the local level to collect this and report this information. And as your committee analysis notes, counties currently do not have the resources for this type of data collection. For those reasons, we must oppose.
Thank you.
Thank you. Mira Morton here on behalf of the California Chamber of Commerce. We're actually in an opposed unless amended position. We have a few concerns specifically about the definition of who's going to be filling out the reports because some of these incidents will happen on employer property and just some other issues that we want to kind of put some parameters around it to make sure we don't end up with unintended liability issues. We're working well with the author's office and we'll continue to work with them going forward, but just wanted to raise that we do have a few issues today. Thank you.
Thank you, Chair and members. Teresa Cook on behalf of the California Travel Association. I want to apologize to the author and committee. Unfortunately, it was my oversight that our names were not listed fully in the analysis this morning. But to echo Mira's comments, I think we've had some great conversations with your office and the sponsors, and that I very much expect by the time we're in appropriations for us to have removed our opposition. So thank you for that.
Thank you.
Mr. Burrows, would you, can Mr. Burrows answer the question?
Yeah.
Go ahead.
The county health officers and the emergency medical service directors raised an important issue, but this bill was never intended for anybody to stop. I used to be an EM22 paramedic. I used to be on the front line. This was never meant to stop anybody from the primary responsibility, caring for the patient, timely transportation. So we've worked out an amendment already to deal with that, to assure that. Also, we're not interested in creating unfunded mandates for the local level. So the plan that the Department of Public Health is to come up with is supposed to have the funding mechanisms or utilize existing services that can readily fill out the forms that are going to come out of this plan. And then we've been working with the Chamber of Commerce to work out to make sure that we're not impacting employers and private sector unnecessarily on this.
And I'm committed to working with the opposition on the amendments that will address their concerns should this bill move forward.
Great. Thank you.
But it's needed.
Thank you very much. Other questions or concerns from the committee members? Anyone else in opposition? Okay, seeing no one, would you like to close, or was that your close, Ms. Brown?
I just asked for your aye vote.
Okay, great. Thank you very much. Need a motion? There was a motion and a second. I apologize. I stepped out. So we have a motion and a second. Motion is due pass to appropriations. Roll call, please.
Wood?
Aye.
Wood, aye. Mainshine? No. Mainshine, no. Bonilla? Burke? Campos, Chu, Dubovne, Gomez, Hernandez, Lackey, Nazarian.
Not voting for Lackey.
Oh, I'm sorry. Lackey not voting. Nazarian? Yes. Nazarian, aye. Olson? Patterson? Ridley Thomas? Rodriguez? Santiago? Steinor? Thurmond? Waldron?